This woman was told surgery was the only option. She had an epidural for a disc herniation L4, L5, no change. Her calf cramped every single day. She walked into my office and in just 8 weeks, 100% pain-free and almost 50% reduction of her disc herniation. Here's how we did it. This patient resembles so many patients that we see. She's tried everything, all traditional methods from PT, cortisone shots multiple times, and she simply wants to just pick up her kids, not wake up out of bed with pain, tie her shoes, and simply travel with her family. This L4, L5 disc herniation on the nerve is causing havoc on her body, and surgery is the only option that was available for her. All those traditional methods aren't gonna actually get this off of the nerve. That's why her calf is so cramped every day when she walks. She's not getting the relief, and now she's frustrated. She's frustrated like all of the patients we see because she's lost and there's no hope, and she really just wants her life back. That's where we insert spinal decompression. She found us like so many of our patients. It wasn't through her medical provider. It wasn't through the anesthesiologist that's giving her the epidural. She found us on Instagram. She found all of our patient success stories. Thousands of success stories, over 500 5-star reviews, and so many pre and post MRIs before hers that show that this disc can actually reduce in size with the correct treatment. So let's talk about the 3-step process, how we got her pain-free and reduced her disc herniation. Number 1, it was the analysis. So we did a pre-MRI. So we had an MRI to evaluate the size of the disc, the location, the migration, up or down or central. Number 2, the assessment. Confirm that's the cause of her problem, and then also, is decompression going to be the right solution and get her pain free? And number 3, so critical and so left out by so many providers. We took more imaging with her than her spinal surgeon. Think about that. That doesn't make any sense. We took a flexion extension film so we could check the movement of her spine as she bends and extends to help us evaluate the angle of decompression and any instability that may be going on in her spine. That's the 3-step process. So what do we actually do for treatment? Number 1, spinal decompression. We used a very specific angle. So she was on her back, her legs were up in the air at a very specific angle for the location of her disc herniation, the migration, meaning did the disc material go back, up or down, and also the movement of her spine. Super important and so missed by so many decompression practitioners, and obviously more imaging than the surgeon took. Number 2, cold laser or low-level light therapy. It's so important to reduce the inflammatory response that's irritating this nerve that's cramping her calf. That's what the laser does. And number 3, once we start to feel better, she's had this pain for over 2 years. So we have to retrain her body for simple movements like picking up her kids or walking out of bed or exercising. That's where we insert power plate. 3-dimensional vibration. You stand on the plate and you do very simple exercises like squats, bird dogs, planks, not only to stabilize those muscles, but when you do it in 3 dimensions of vibration, it re-triggers the brain and the proprioception to train it faster and up to 140% more efficient muscle activation. Those are the 3 steps that we did. The important milestones, after 4 weeks, she was already 50% better. That's when we jumped on the power plate to start strengthening. If you've ever tried physical therapy and it made it worse, it may not be that it was the wrong exercises or it was bad, not what I'm saying. It could have just been the wrong timing. Your body was in fight or flight, in stress mode, because you have that going on and it's not ready to strengthen. The strengthening of your body, your core, your glutes, your erector spine muscles, your glute medius with side planks, all of those exercises, they have to be done at the precise time when your body's not fighting it and in survival mode. So that's when it was 4 weeks in, 50% better, we jumped on the power plate. That was key. If we started it too early, it would have flared her up or made no significant change. 8 weeks forward, in just 8 weeks, she's almost 100% better. And in 3 months, 100% relief. No more calf pain, cramping, walking, getting out of bed pain-free. She's actually starting to exercise again. And the most important part is when her kids run to her to give her a hug, she doesn't say, no, mommy can't pick you up right now. As a parent, I have 3 kids, that is the worst feeling when you can't grab your kid when they run to you. And in just 3 months, she's hugging them, picking them up, walking with them, and that is the most rewarding part about decompression. 1 month later after that, we did a post-MRI. We showed that this disc, it's healable. It can heal. And in 4 months, that disc reduced by 44%. Off the nerve, no more cramping, 100% pain-free in just 4 months. All with our disc renewal therapy and spinal decompression. It's obvious that you're having lower back pain and you want to get relief. Text me the word relief to 925-291-5670 to download your free low back pain guide. Start fixing your back today and get the relief that you deserve. Listen, if you've been told that spinal surgery is your only option and the traditional methods are not working, like injections, medications like gabapentin, and you're looking for answers and you want relief without surgery, it is so possible. I want you to DM me at Instagram, Dudum Chiropractic, or comment on this section for a complimentary phone call with me to see if myself or one of our teammates can help you get your life back without invasive treatments like spinal surgery. I'm Dr. JD Dudum. This is the Back at It with Dr. Decompression. Thanks for listening.